Too often at the government level, we look at poverty as something that is an individual's faults when there's actually a lot of structural issues that come into play or barriers that come into play that an individual themselves just can't address by themselves. There are great government programs out there like SNAP that actually do help people and provide food share dollars and EBT dollars to families and individuals. But what we discover too often is that there are still a lot of food insecure individuals who don't meet that threshold to then even qualify for those federal assistance programs. So the idea came forward with the fruit and vegetable prescription program to be able to offer that access to food and those resources when they walked out of the door in a place where folks came in to actually get assessed or to treat a health concern. Identifying yourself as food insecure, it's a dignity thing, right? And so it's hard for people to really delve into that level of what they're going through in terms of their issues and then identify with really a perfect stranger. I think some of the ways that we've addressed that is by them being able to talk to their physician, whom they know they already have a confidential relationship with, and then them being able to actually walk out of the door with resources right then and there. Not saying that you have to call somebody, not saying that you have to go on the internet and sign up for something, but walking out of the door with $120 in coupons and an access membership coupon to the Willy Street Co-op, I think is something that's really powerful for people.
So then what are going to be your markers for this? How are you going to measure the success of this program?
I guess if you want to look at success in terms of the number of people who have enrolled, which is one of our metrics for success, we had originally planned to have 185 people enrolled in this program over the course of 12 months. What we've discovered is in the course of about 1 month that 167 people were eligible and signed up for the program. The program is still in its infancy, and so we're still gathering data and fleshing out what the data actually means in terms of success metrics. But what we'd like to see is that the folks who came in, identified as food insecure, and then enrolled in the program, we want to be able to track redemption rate. We have someone who's actually doing follow-up surveying and discover if they're using the fruits and vegetables to do cooking in the house and what they're using it for. Are they feeding it to their kids or to other members of their family? Have they noticed health improvements over the course of time?
If I'm someone, I've seen my doctor, I've expressed that I have issues with food security, what happens after my appointment and I'm given these coupons? Like, how does this whole thing work for the individual?
You're screened at the doctor's office. We have worked with Northeast Family Medical Center and the doctors and the room staff and the nursing staff and the administrative staff to actually administer these protocols and these questions to screen everybody who comes in. If you screen positive, again, you are offered the option. You do not have to enroll, but most people we found enroll in the program. They fill out the consent form, and they walk away with a packet that's put together with information on how to use the coupons themselves, a brochure on the fruit and vegetable prescription program, and then a coupon and information on the access discount program at the Willy Street Co-op. And so at that point, when you have that packet, you could walk right across the street to the Willy Street North Branch. It's another reason that we chose the Northeast Family Medical Center and Willy Street Co-op, because the clinic location and the North Branch are literally right across Northport Drive from one another. So you could take your coupons, walk over to the North Branch, and redeem them then and there for any amount that you deem appropriate for fruits and vegetables, up to $20 using those vouchers for the next 6 months. And then we follow up with you. Project staff follows up and just says, hey, how's it going essentially? Have you used the vouchers? How are you liking the program? Are you noticing any changes in your health or diet? And we try to do those at increments that are spread out enough where we can actually gauge some change in people, right? We're not going to call you 2 days after you get the vouchers, because what are you going to know by then? And so we've really tried to design the program where, we're not really being a burden on people, but we can still collect the information that lets us know how we can either change the program to become better and function better and serve the population we want to serve better, or what's really working well right now and what we want to keep moving forward.
George, why is this important to you?
There are a lot of people in need out there. There's a lot of people that fall through the cracks in terms of not being able to get what it is they need. And I think that local government, private entities, and partnerships and collaborations between them can really help to address those gaps in the assistance that we provide. And I really think that doing it in a way that people don't look at as being punitive or being judgmental is really helpful to actually getting people to use the services that are offered. And so it's important to me because I want to help people. I want to see people get a leg up and have the chance to improve their standing and rise up the economic ladder, because I think that's what anybody wants. They want to have purpose and they want to be comfortable. People want a decent life-supporting wage so that they can have a solid place to live with their family and purpose in what they do. And one of the gateways to doing that is having a secure supply of good, affordable food, because health is the baseline and the foundation of everything else. If you don't feel well, you can't work. If you don't feel well, you can't take care of your kids. If you don't feel well, you can't enjoy leisure time. And I think by eating healthy, it allows you to be healthy and to accomplish those goals.